Now at 4, your community focus, we're talking COVID-19 and other health topics today with Dr. Jim McDonald from the Rhode Island Department of Health.
He joins us once a month now on 12 News Now at 4. Dr. M, thanks for being with us.
It's great to be back with you guys today. Thank you, and a very happy Thursday.
Happy Thursday. We know you're back from vacation, so 2 questions to start. How was vacation? And also, what would you say to folks who maybe have some concerns about being comfortable traveling? You did it.
I did it, and I'll say this. I think, I purposely disassociate my mind from work when I'm on vacation. That allows me to form positive family memories that are permanent for me. It allows me to restore my soul. And I think that's important, to go on vacation, positively disassociate from work so you don't think about work. That's what I did. I found travel very safe. People were wearing masks on planes. Although airports were crowded, they weren't overly crowded. There was seats in gate areas, and I felt it was a positive travel experience. I flew JetBlue. I've always liked JetBlue. They're nice to me.
Who wouldn't be nice to you? Let's be real.
Yeah, seriously.
All right, Dr. M. So mask guidance has changed significantly just in the last week, including non-vaccinated people not needing to wear masks outside. Can you walk us through some of the data that's driving that change?
Yeah, I think the simple thing is when you look at what the CDC was talking about and what the Department of Health is addressing is, it turns out outside is very safe. There's a lot of great ventilation outside. One of the things we have in Rhode Island going for us is we have an ocean, by the way. So please do go to the beach. Even if the weather's not great, by the way, that's another place to really give you some peace of mind. But the ventilation outside is, quite frankly, so good. There really isn't a lot of risk of transmitting disease, and that's the science behind this. That's the story there, is just going outside is very safe. And so whether you're vaccinated or unvaccinated, go outside. You don't really need to wear a mask unless you're in a really crowded place. Then if you're in a crowded place, you should wear a mask. Or if your immune system isn't what it should be, and if you're one of those folks where your immune system isn't what it should be, your doctor has told you, then you might want to wear a mask in that case.
Dr. M, I want to ask some non-COVID questions. First, this week we reported about the first human case of a strain of bird flu in China, and I'll admit I started to get some flashbacks of December 2019. How concerned should we be about this?
Yeah, so we saw the first case in the world that we know of H10N3, and each flu, these flus have names. The H's and N's mean things, most so to people like me. I'm not worried about this. I'm not worried there's going to be another global pandemic over this, and I don't want anyone else to be worried about it. Can I invite you to let me worry about this for you? And if there's a problem, I'll let you know. But right now, it's one of those things where it's an odd circumstance. I'm actually more relieved that we know about it and less worried about it. So I'm not super worried about H10N3, but it's something Dr. Chen and I were talking about today. We both think it's just a story that made the news, but not something super exciting.
Okay, that's good news indeed. It is starting to feel like summer, and you were talking about getting outside. I know mosquitoes and ticks are always a health concern. So let's talk about how concerned you are about tick-borne and mosquito-borne illnesses. Is there any indication of how bad of a season it might be for that kind of thing?
Yeah, and it's really important to know that we actually do surveillance for the mosquito-borne diseases. So just so you know, we're going to look for Zika, we're going to look for Triple E, we're going to look for those diseases in the mosquitoes. If we see them in the mosquitoes, we let you know, because then we know you need to be worried about that. But I think it's important for the ticks in particular, just the ticks are there, right, guys? In other words, if you've got grass, you got a yard, you got ticks. And it's just important to just say when you're outside and you come back inside, you should assume a tick. Just suck along for the ride and go find it. It's one of those things where they come into your home, just look for ticks. I wear insect repellent when I'm outside. I encourage people to do that as well. Get a nice high DEET concentration, at least 20%. If it's on clothing, get something with permethrin in it. But get yourself a nice insect repellent that you like. Hop over and grab one. And I think it's just important to look at your kids, by the way, too. When your kids come in, they don't always know. But, late at night, take a look at yourself, see what's going on there.
And Dr. McDonald, we have about 40 seconds. I was getting my haircut this week, and one of the conversations where I was having my haircut was, well, we're all going to be really sick this year because we have been wearing masks. We've touched on it briefly in the past. What's your take on where that stands right now?
Well, one, your hair looks great, and two, I think people need to not worry about just getting sick because we're not wearing masks. In other words, I think we've learned a lot of good public health prevention, by the way, during the pandemic, right, folks? In other words, our immune systems are good. They're going to be strong. I'm not super worried about people getting sick. I do think it's important to remember some lessons. So one, if you can't take 20 seconds washing your hands, you go ahead and lighten up that schedule. That's a doctor's order for you right there. And you know what? Let's not go to work sick anymore. That's another big thing we learned too. And if we stop going to work and school sick and we, keep ourselves at home we're sick, this will bring us a lot of good benefit there.
Dr. Jim McDonald from the Rhode Island Department of Health, thank you so much for your time today.
Thank you, guys. Have a great day.
You as well.